Hi guys, how you doing? So this is LaQueen. It is Saturday, August the 15th. Okay, I'm getting ready for Wisconsin in a little bit. So I did my first YouTube video was on medical ethics. I'm going to go ahead and right now it is editing in my YouTube. I'm just going to go ahead and make some edits right here. Nursing medicine ethics. Give me one moment. Okay, one moment. Give me one moment, YouTube. All right. Okay, great guys. Okay, so my video right now is 10 o'clock, 10:30. It's called a scope of my own scope of practice. Okay. So what it is my scope of practice pretty much is and guys, I'm not a doctor. I still have to be cleared by the board, and I have to do the exams, as well as I pretty much have to get more training. Of course I need more training. Of course I don't know anything. I'm just a medical assistant. I'm just community health. That's pretty much what I do. But I'm getting experience on the field, as well as when I apply to Harvard or Boston University or University of Mass Medical School, I can then get that clinical experience in order to qualify me so I can be on that same level with my peers. So I have the outside that outside experience in the field. I have the field experience as well as the clinical experience. So that's what you have to be. You have to figure out, what is my scope of practice? What am I available to do within my credentials, as well as outside my credentials? So I don't want to be liable. I am, and I also do have insurance as well to make me. I'm certified medical assistant. I do have insurance through my company, through a company that has pretty much. I was telling them I'm available, liable for anything, and they pretty much gave me insurance, liability insurance, pretty much to practice in my profession. Okay, so what it is it's called your it's your scope of practice. Okay, so I'm gonna look it up right here now. Okay, so AMA fights scope expansion, support physician-led care. Okay, so pretty much what it is now, I am certified as a adult and pediatric first aid care, as well as certified CPR, CPR, AED, and first aid through American Red Cross, the American Red Cross, American Heart Association. And then I'm also certified medical assistant, certified clinical medical assistant, front and back office, as well as I'm a certified Narcan opioid overdose assistant. So I'm able to administer naloxone, as well as I'm a certified adult and adolescent suicide prevention, mental health care, as well as I'm certified to understand community involvement with COVID research through the World Health Organization, which I have been through various 10-hour courses through the World Health Organization as well, which the World Health Organization has 10, 20, 15-hour courses on COVID research as well. So there's a lot more to be involved in it, and pretty much what you need to do in order to, I need to get my hair done, in order to provide services for COVID research. Okay, so pretty much I'm right here. I'm on the Wikipedia. Okay, you just Google what is scope of practice. What is scope of practice? So pretty much, scope of practice is the means that you are able to practice in your profession, which is legally as a lawyer or as a professor, teacher, how limited, as well as how much you are able to do with your profession. Whether if you're a teacher, you could do research, you could be published, you could become an author, you could run an elementary school as a teacher, as a professor. If you're a professor, you can run a clinic, you can run a college, university, and still become a professor. You could do your own research, you could become an author, you could become a pastor and you're still a professor. Or if you are a daycare worker, you can own your own business. You can also be do community health in your own do community events and still run your own daycare. Do events within your community as well as do CPR services, do CPR classes, and still be a daycare worker. So as whatever you want to do, how limited you are, or how much you are able to expand with your degree, with your diploma, with your certification, with whatever you went to school for. It's pretty much what you want to do with whatever you can do about it. With whatever resources you have available to you, use them. So pretty much it's pretty much what a scope of practice is. Now here on the Wikipedia, the term for scope of practice pretty much describes, it says here, it describes the procedures, actions, and processes that a healthcare practitioner is permitted to undertake in keeping within the terms of their professional license. Okay. The scope of practice is limited to that which the law allows for specific education and experience and specific demonstrated competency. Each jurisdiction has laws, licensing bodies, okay, because you need to go through the body, through your own group of peers in order to become licensed in that profession, as well as has different regulations that describe requirements for you need education to become this, as well as the training. Of course, you need the education, go to school for it, of course, as well as receive on the field training or clinical training through a residency or through an internship or through any kind of program to get you that on the job training that you need for the position and to define what your scope of practice is. Now, it says right here, in most jurisdictions, healthcare professions with the scope of practice laws and regulations include any profession within healthcare that requires a license to practice. Okay, so physicians, physician assistants, nurses, dietitians, respiratory therapists, physical therapists, PTs, OTs, pharmacists, and dentists. Governing, licensing, and law enforcement bodies are often at the subnational level, but federal guidelines, regulations also do exist. For example, the United States, the National Highway Traffic Safety Administration and the Department of Transportation has a national scope of practice for emergency medical services. So it depends on what level that you practice your field in. So if your field is in a regular community center, you're limited within that your local within the local community that you practice in. If your field is at a school, at a college or university, you're limited within that college or university. You can still do different things in that college university with your education, with your training, but you are pretty much limited within what that college or that university will let you allow. Now, if you are on the streets, or if you are in the military, or if you work with the federal government as a contractor per se, and you're going from different cities to cities to cities to traveling, and also doing the same work, then under the guidelines of the agency that you work for as a contractor, or under the guidelines of the business that you are doing that contracting work with, then they will allow you, especially with the government, especially with the military, they will tell you what they need to do and what you are allowed to do and what you are not allowed to do within the authority of the government or within the authority of the military or within the authority of that jurisdiction that you are working with. So pretty much you still have to get permission from every single jurisdiction that you work with. Just say hello, how are you doing? Just wait, just pretty much let people know who you are, as well as provide identification for what you are doing. Literally, you have to provide identification and you have to show proof that you are certified, as well that you are well qualified to do the position that you are doing. Okay, so it may be a little bit crazy to some people to see, why is this person walking around the building, or what are they doing, or whatever. You still have to somehow make sure that the work gets done, or that people know around you are involved in the whole aspect. Now, sometimes there may be situations where you, as in the medical field, are working with a project, are you in the medical field, are exposed to a clinical procedure, are you exposed to an epidemic that is beyond your control? So say, for instance, when COVID started, there was a really bad flu season. around August, September of 2019. The flu season was really bad, especially in New York on the East Coast. Hospitals, especially in Buffalo and Syracuse, were filled up to top terms with the emergency rooms were packed with people in the emergency rooms, especially in Buffalo, New York, at Buffalo General Hospital. So pretty much the emergency rooms were packed with 100, 200, 3 people. And guess what they all were doing? Everybody was doing the same thing: coughing, sneezing, throwing up, coughing, sneezing, and throwing up. Literally all over the emergency room floor in Buffalo, New York, and on the East Coast. So pretty much, and at that time, the staff in the emergency room were very much limited in what they could do. Because number one, they were short staffed. Number two, they had a very limited staff who knew what was going on. They didn't know there was COVID yet. They didn't know it was coronavirus. All they knew that it was a really bad flu season. And on top of that, they did not get any direction from overhead from the hospital administration of what to do about this really bad flu season. Okay, so pretty much what you have to do is within your own scope of practice, you really need a backup buddy or a buddy system. Or you need, if you do not have a buddy and you're pretty much on your own independent contractor like myself, you still need to have some kind of communication between you and the agency or the group of bodies that you are working with to let them know, okay, hey, what do you guys need for me to do? If they don't say anything, still be there. Still show up, still provide services because you never know when your services are needed and rendered, especially right now going through COVID research, as well as pretty much people never know what's going to happen when they need it. Literally. And they can say, oh, it's closed when it's open. They could say it's going to be a small crowd when it's 20,000 people. They could say, oh, nobody's going to show up when you have somebody very important shows up and you need security for that as well. So there's a lot of things you never really know what will happen until it happens. So you literally have to be up to date with the news as well as up to date on professional journals, professional medical journals, professional newspapers, as well as pretty much being available. Okay, being available for assistance. Literally, I mean, like literally being available. Because you never know when people are going to need your services or need help. If and on top of that, if you are in any kind of field right now in emergency medicine, if you are involved, if you are certified, even if you have a CPR certification, okay, you are still a first responder and people still need services from a CPR certified person. You really never know how much people really need a CPR certified person. Or if you're certified as a lifeguard, you never know when people need you. It's not even need you on the beach. They just need somebody to overwatch a group of kids. You never know what will happen. So even any kind of field in medicine right now is definitely needed as a first responder. Okay. As a first responder, you can be a first responder and be in any field of medicine right now. Or you can be a first responder and be a teacher, a cop, a security guard at the mall, a security guard in your neighborhood, working for the transit system. You're still a first responder because you are the first one on scene and people need you at the emergency situation. So you are still a first responder, even if you are a transit operator, even if you are a transit clerk, if you are the cleaning crew in a big federal transit facility, like a train station or the Amtrak, are Greyhound, you are still a first responder. So you have to let people know who you are, as well as let people know that your services are available and your services are pretty much, you never know when your services are needed. So that is why a that is also what you could do within your own scope of practice. Okay, so right now in the medical field, right now especially with COVID, excuse me, people really need medical services. You never know how your certification can apply to any kind of situation right now, whether it's in your community or in your neighborhood, at the mall, at church, at the airport, at the Greyhound station. You really never know when your services are needed. It could be anything you took a CPR class or you took a babysitting class. You never know when your services are needed. Okay. Seriously. So show up, be available. On top of that, just let people know, hey, I got CPR certification. Let me know if you need help. Oh, I took a babysitting class. Let me know if you guys need help. Oh, I'm a registered nurse. Let me know if you guys need help. Um, oh, I took a suicide prevention class. Let me know if you guys need help. Oh, I'm a COVID person. Let me know if you guys need help. You know what I'm saying? I'm a COVID tracker. I'm a tracker person. Let me know if you guys need help. You never know. Okay. So that is also another issue, especially right now with first responders. People need first responders, not just police officers or firefighters, but people need people that are available for emergencies. That's why it's called a first responder, because you're the first person on and to respond to emergency situation. Okay. There you go. And you took some kind of certification in it. Okay. Now, like for example, like a registered respiratory therapist or a paramedic, you still have to go through your own state registering authority as well as the government authority to let people know, to let your own board of peers let them know that you are available for services in your own city or in your own state. Okay, especially when you get higher up that ladder of credentials. You go from registered nurse to LPN to RN, from RN to PA, from PA to nurse practitioner, from nurse practitioner to MD. And you can even get a doctorate degree in nurse practitioning. So there's a lot of other things that you can do on the side as well within your own scope of practice, as well as continuing moving up the ladder of medicine. So there's a lot of other things you can do within your own scope of practice. Okay. It's just pretty much what you are available to, as well as who will allow you to do what you want to do. If people will not allow you to work at your job how you want to work, you pretty much have to call your authorizing agency who gave you the credentials and let them know, hey, I want to do this. Can I do this? And if your authorizing agency says, yeah, you can do that, that's fine. Then okay, find some way to keep practicing medicine the way you love to do it. Okay. Do not let people hold you back from doing a procedure, a safe procedure the way you want to do it, whether it's safe for the patient is a better handling of the procedure, and you see the provider doing it a different way. Just make sure you get a second thought and a second look from the situation. Get approval. If you can't get it through your job, get it through your agency. If you can't get it through your authorizing agency, get it from your board. If you can't get it from a board, go to the Department of Health. Ask your local Department of Health, am I authorized to do this within my scope of practice at my job, or if I can start my own business and still do this, and get approval from your Department of Health. They will figure out, let you know. But don't let anything hold you back in medicine, especially if you have a passion for helping people. You are ethical, sound mind, as well as you have a passion for helping people. Do not let people at your job or supervisors or even people in the community, your own family, keep you back from doing what you love. Okay, because eventually it will come back to you and be returned to you in full. Okay. So, like here as a paramedic, there with a paramedic scope of practice in some states and provinces in Canada or Europe, a paramedic is allowed to perform percutaneous cricothyroid thyroidotomy if all other airway management fails. In the states and provinces that do not allow this intervention, it is not within the scope of practice of the paramedic to perform. So usually something like a cricothyrotomy, where pretty much just what I'm saying, cutting the throat. So that's also where they make a decision to get that airway through, to insert that tube into your throat to get you to breathe. So some states allow it, some of those states don't. It depends on what the EMT is allowed to do. Okay. As well as even if you're working with federal government, especially with the federal government, you have to go through so many hoops and bounds to get permission to do what you want to do. But if it is an emergency situation, especially in the military, especially in government, federal, or you're contracting, you're working overseas, and it is an emergency, you have to be available for anything and everything. Literally, if it's a cut, a band-aid, or they need to be a pregnancy, a delivery, or somebody is having a seizure, or if somebody needs brain surgery. Literally, you have to be available. So with the federal government, you never know you never know what's going to happen until it happens. So I still have a lot more training to do. Okay, this is just a start. Okay, especially with preventive medicine, the best thing for prevention is just to be available and have all your resources on hand just in case an accident happens. So supplies are on hand for prevention as well as education. So the best thing for preventive medicine, of course, is having your supplies on hand. And of course, knowing what is going on in your community, always keeping up to date with the events going on in your community, what's going on in your neighborhood, what's going on in your school, what's going on in different hospitals, and also getting up to date on the research, the medical lingo. Okay. So not really, I'm not talking about like Wall Street Journal per se. Like this is great for doctors. The Wall Street Journal is a great newspaper to read and just to keep up to date with what's going on in the news per se. But more than just the Wall Street Journal, I'm actually talking about the national, the monthly newspapers, the monthly publications that come out from these medical journals. So they usually come out once a month, and they're published by the Harvard Medical Review, the Harvard Law Review. They have published from people that had been to their boards of their communities, as well as that had verifiable research and evidence and charts to show to their own board of peers that have verified all their scientific evidence, all the charts, all the proven evidence, all the proven stats, the numbers that what they're talking about is right. So in order to be published in a medical professional journal of literature, of medicine, of law, of history, even of archaeology research journal, you still have to be approved through a board of your peers, or apply that article to the medical journal, to a law journal, and then they have to also overview it with the editor, and the editor also has to overview it with some other people that are specialized in that field in order to get the research. You get me? So that's another way that you could do it within the scope of practice as well. So again, everything is always within your own group of peers. So pretty much what you want to know is, what am I able to do and what I'm not able to do, and what also are my other group of peers doing around me. Okay, so that is also another way to figure out what is my scope of practice. Okay, now the basic requirements for a any kind of health profession. Okay, especially in the medical field, as a registered nurse or as a doctor or as a CNA, PCT, or a CMA like myself, as well as for CPR. The basic requirements, literally, okay, you have to be an adult. You have to be over 18 years old, as well as you have to be physically and mentally available to provide, mentally and ethically able to provide services for your other self. You cannot be suicidal. You cannot be a danger to yourself or others in order to practice medicine. So you can literally have a 12-year-old practicing medicine, but they have been cleared by their own group of peers, as well as by their parents or their adoptive families, or whoever is taking care of them, to be able to practice and administer medication, because that young person has taken all the credentials they have in order to be able to practice medicine. Okay, so literally that 12-year-old child can actually have gone through the Mensa, which they are a genius, and they also have gone to medical school, as well as gone to pass their boards, and they are literally like Dr. Dookie Howser, able to practice medicine. Okay, so he was a young kid, old 80s, 90s TV show, who practiced medicine as a young child, as a teenager. Okay, so Dookie Howser. So there's a whole bunch of other fields out there where you are available to practice medicine, as well as number one, you have to be of age or you have to be accepted within your own group of peers. Number two, you have to be ethically and mentally sound. You cannot be a danger to yourself or others, as well as you cannot have a history or you have any issues with alcohol or drug addiction. You have to be ethically sound, as well as number three, you have to actually take the credentials or take all the prerequisites that are needed for your education. Say, for instance, you want to get a CPR class, you have to take the American Red Cross online course before you attend the class, or to become a CNA, you have to go through the 12-month program or the 6-month program through your state or through a school in order to get certified as a certified nursing assistant. Or as a medical assistant, a PCT, you still have to go through the school education in order to be certified that, or receive grandfather training, as well as through a registered nurse or an LPN. Same thing. An MD, though, an MD and a registered nurse, you also have to receive the training. You also have to get the residency requirements. You also, now it gets a little bit higher. Okay, it gets a little bit higher when you go to the registered nurses and when you go to the MDs, because there's a certain amount, there's a clinical hours limit that you have to meet every single month, every single year in order to keep practicing your credentials. So with registered nurses, it may be you have to practice clinical services for you practice 100 hours of clinical work a month as a registered nurse. Or as an MD, you have to practice 500 clinical hours a month as a registered as a medical doctor, or as a surgeon, or as a pathologist, or as a anesthesiologist. You still have a limited, a minimum amount of clinical hours that you need in order to practice, keep that licensure. So with doctors, the boards that they would do may actually have require them to have a minimum amount of clinical hours as a medical doctor or a doctor of osteopathy. Usually, doctors, MDs have a minimum like 500 clinical hours a month, or some are 10 or 20 or 100 or whatever it is, but their state boards or whatever their governing bodies are give them a minimum limit of hours to practice under that certification. Okay, so under that certification, they can practice clinically, or they could do research, or they can do both, but they have to be practicing within that profession, within that licensure, a minimum amount of hours every single month, not every single year. Okay, literally, the board governing body has given these people a minimum amount of hours to practice using that credentials underneath a month. For every single month, they have to record every single month the hours that they're practicing and turn it into the governing licensure body to let them know that they are still handling their licensure medically, as well as clear to have no liability claims against them. Literally, nothing liable against them under that medical profession. Not been any civil suits, not been involved in any criminal activity, not any problems with drug or alcohol addiction. They have to be cleared by community, that they're well sound in the community, as well as, of course, being clear for drug or alcohol addiction or any kind of legal issues. So that's another issue, being cleared, physically, mentally by your own community standards. Okay. So that is another issue to go ahead and continue practicing medicine, literally. Okay. Your own community standards could be against you sometimes. Okay. So that is also another issue that we have to take into mind, your own community standards, as well as what your own governing body is telling you. Okay, so there's a lot more involved within the scope of practice. Again, it's between you and your agency or your job, your supervisor, your job. What are you limited to do? What can you do? And as well as applying, moving up the ladder. So there is a lot of other issues um, involved right here. Just keeping up with the standards in your community. So especially as nursing, it says they have been educated, titled, and maintain active licensure in their state to practice nursing. And then what? It is a protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. Wherever there's a patient in need of care, whenever there's a need for compassion, expertise, and nursing knowledge, and they're able to achieve the most positive patient outcomes in keeping with the nursing social contract and obligation to society. Okay, so that's also within the nursing, the nursing LPN RN scope of practice. Okay, now I'm gonna go ahead and go right here to the medical assistance scope of practice. Now, um, with a medical assistant, they need to be knowledgeable on their scope of practice in the state that they are practicing in. What a medical assistant can do varies from state to state, but they pretty much do basic clinical services more so than a CMA does. Okay, so a CMA pretty much does basic home bid bound care. A lot of bid bound care is what a CNA, certified nursing A, does, as well as a PCT. A patient care technician, can administer IVs without having to take additional classes, more so than a medical assistant can do. So therefore, you have to figure out what your own scope of practice is. Okay, CMAs, PCTs can even do patient care. They can do ECGs, EKGs, as well as other diagnosis tests under the supervision of an MD or a DO and a nurse practitioner, phlebotomy, as well as pharmacology. So CMAs are also able to administer medication with the approval and the overhead of a provider. So it says, it just really, especially with the American Association of Medical Assistants, right here. Now, there's different duties. That's what your scope of practice is called. It's called your duties. So you can do above your duties or you can do below it, but it really just depends on what you want to do. Now, the Board of Registration in Medicine, Licensing and Practice of Medicine, Regulation Chapter 2, Licensing and Practice of Medicine. Here's by Massachusetts, as was immunization administration by medical assistants in Massachusetts, and an act increasing access to immunization, which a lot of people do when they see, oh my God, I need to get my baby shot. I need to go get my school shots. That's a medical assistant more than a PCT. A PCT is mainly in a hospital setting, and a medical assistant, therefore, is in a clinical setting where they're able to do day-to-day duties in a clinical field. And a hospital field with a PCT is more on a emergency basis, okay, as well as a pretty much day-to-day basis, okay. Let me look here, right here, where it says about Massachusetts. And I gotta get ready. I just pretty much want to make these videos as quick and clean as possible to let you guys know what is really going on. Here it is, right here, Board of Registration. I'm just trying to get the date. Now it says right here, it says, for the purposes of right here under the Board of Association, American Association of Medical Assistants, it says for the purposes right here, it means the practice of medicine means the following conduct. The purpose or a reasonably foreseeable effect of which is to encourage the reliance of another person upon an individual's knowledge or skill in the maintenance of human health by the prevention, alleviation, or cure of disease, and involving or reasonably thought to involve an assumption responsibility for the other person's physical or mental well-being, diagnosis, treatment, use of instruments or other devices, or their prescribing, administering, dispensing, and distributing of drugs for the relief of diseases and adverse physical or mental conditions. A person who holds himself or herself out to the public as a physician or surgeon or with the initials MD or DO in connection with his or her name, and who also assumes responsibility for another person's physical or mental well-being is engaged in the practice of medicine. Okay. So right here it says a person who holds himself or herself out to the public as a physician or a surgeon or with the initials MD or DO in connection with his or her name, and who also assumes responsibility for another person's physical or mental well-being is engaged in the practice of medicine. Okay, so as it says, what does Massachusetts say about it? It says it. That's what it says. It says the practice of medicine. It means okay. That's what it says. Now it says general provisions governing the practice of medicine. It addresses some issues concerning the practice of medicine by licensees. It says delegation of medical services. There shall be no delegation of medical services to an individual who is not licensed to perform those services in Massachusetts. Nothing in 243 shall be construed as permitting an unauthorized person to perform activities requiring a license to perform medicine. Okay, so it says right here, it says 243.CMR 2.074 shall be construed as permitting an unauthorized person to perform activities requiring a license. It says it shall be construed as it says right here. It says delegation of medical services. Okay. Right here. It says there shall be no delegation, okay, of medical services to an individual who is not licensed to perform those services in Massachusetts. Nothing in the law 243 CMR 2.074 shall be construed as nothing in the law shall be construed as permitting an unauthorized person to perform activities requiring a license to practice medicine. A full licensee who knowingly permits, aids, or abets the unlawful practice of medicine by an unauthorized person is subject to discipline pursuant to the law, MGL 112.5 and 243 CMR 105, which is pretty much general. Okay, so the Board of Registration in Medicine often receives inquiries from physicians, healthcare facilities, and patients. Below is a list of frequently asked questions about recent amendments to the law. Under the amended Delegation of Medical Services Regulation 243 CMR 207, can unlicensed medical assistants, audiology assistants, and other skilled assistants continue to provide care in Massachusetts? Medical assistants and other skilled assistants can be involved in patient care under the supervision of a licensed physician as long as they are not performing a task that requires a license. Okay, so it says right here, it says medical assistants and other skilled assistants can be involved in patient care under the supervision of a licensed physician as long as they are not performing a task that requires a license. The intent of the regulation was to prohibit unlicensed or formerly licensed persons from performing activities requiring a license to perform practice medicine. Delegation of medical services is not permitted to individuals not licensed to perform that medical service. Medical services delegated to assistants do not include performing invasive procedures, except when state law specifically authorizes it. For example, MGL 112 and 265 allows certified medical assistants to perform immunizations as outlined in the statute. The board also has regulations on physician assistants, 243, and advanced practice registered nurses. Okay, so it's different. It just really depends on what your state body does. Okay, now with the state of Massachusetts, the state of Massachusetts has other laws involved to practice medicine. It's called, in order to distribute any kind of medication, to perform any kind of injections, to perform a flu shot, you have to take what is called a MAP class, a medical administration perform class. And I'm still trying to get that certification too. Okay. The state of Massachusetts, the city of Boston has the MAP classes for certain agencies as well as certain private individuals perform MAP training is what medical assistants as well as other licensed professionals need in order to administer medication. You need to get that MAP class. It's not a MAP grant, has nothing to do with immigration. It's called a MAP class through the Massachusetts Board of Health. You need what's called a MAP class, okay, and as well as to take the MAP test exam in order to be able to administer any kind of medication, if it's oral or if it's an injection or if it's a TB test, you still need to take the MAP class in order to administer any kind of medication. So even though I have a whole bunch of over-the-counter drugs right here, but I still need to take that MAP class in order to administer those medications. But if they're over the counter drugs, then it is within my scope of practice to administer those drugs as needed under the direction of a physician or a governing body, which is why I need to get in contact with a hospital to oversee me and oversee the duties that I perform, as well as I need to get in contact with get a license with, get a contract with a supervising physician to also oversee my business, my budget, and a lot of other details that are needed for battle first aid responder services. So again, it says right here in the law, the state of Massachusetts, that medical assistant needs to be under the direction of a physician or a governing body, as well as they cannot practice any kind of medicine if they have not been licensed in that field. So, as you know, guys, I have been licensed through the various certifications that I have. Okay. So I will continue the training that I'm doing right now. I have been licensed as a medical assistant. I have been licensed as the general smaller classes. I take the smaller license certifications and then I work my way up to the bigger licenses, the MAP license, the more licenses, as well as then eventually the MD licenses. So there are a little bit more, little bitty certifications along the way until you can actually reach up to that main goal, which want to be the MD. Okay. And there's different licenses. Like if you work in construction, you need your OSHA license. If you work as a teacher, you need your teacher assistant or your Board of Education license to practice teaching. If you are a lawyer, you need your lawyer's certification. Go through, be approved through the law, the boards, be able to practice law. If you're a police officer, you need to go through police academy and pass a police exam to become a police officer. If you're a firefighter, same thing. You still need to go through your local, get the education. And then once you get accepted, get the education, then you can take the exam. After you pass the exam, you can get that certification, that registration that you need. Now it's different, especially right now with the COVID crisis. A lot of everybody needs pretty much all the hands that they can get, all hands on deck. Okay. With the COVID hospitals, with schools closing down, with a lot of on the street activity, people can do anything with their credentials as possible. It can be your scope of practice could be involved in pretty much anything right now because people need as much hands on deck as I can to help people with this COVID crisis. So literally, you can use all the experience from your COVID, all this training you got this summer, as well as over the past year as a CNA, as an RN, and use all the experience and the code that's taught you at the facilities and use that towards getting your goal of going to pursue your business and your MD whatever it is you want to pursue in the medical field. You can still use that on the job training, and that on and job training also counts for education as well, as long as it was under the supervision of an MD. Do you guys get what I'm saying? You can still count on the job training, field training, as long as it was under the supervision of an MD. You can still count that as training, but you still have to go through the boards, the governing body of your state. Go through all the paperwork. You show that you did all this training. You got the approval from the doctor. You have the doctor's sign off signature. Then you go through your board, your state boards, your the Department of Health, your licensee board and regulations, whatever you got your certification through, and you say, hey, I want to apply for this credential. What are your guys' requirements? I have this license, I have that license, I have that license. What do you want me to do? What can I do now? Sometimes you are grandfathered into a situation with all the additional training that you can get. You have so much more training clinically on the field, not just at these projects. I'm talking about more clinical training on the field and overseas work, working overseas for different countries overseas. And then when you come to the States, they see all the experience that you got overseas, and all you have to do is just take a test. And you got that certification, you got that license. Or you have to prove to your governing body, you'll sit before a board, and you say to that board, I know that I am of sound mind to practice it, and I will give you different examples of what I've done. And they can literally prove to people that have pictures, they have charts, they have graphs to show that they are of sound mind to perform this profession in the field that they want to. Okay, so it is a lot, especially with immigrants, especially people of different cultures and languages, Africans, Asians, Indians. There are doctors in their communities. And then when it comes to the states, a lot of the states don't accept their outside accreditation. So usually what they do, they have to get approved through the board of the state. And then the board of the state have to say, okay, we accept these credentials. Or the hospital have to go to the boards of the hospital. And then the boards of the board of directories at the hospital approves for that person to practice medicine at their hospital. Even if they are from a different country, they have to go through the different steps, hurdles in order to practice medicine at that particular hospital, which is what a lot of immigrant families do. Okay, so there's a lot of different ways you can be grandfathered into it, still get the on the job training how they want their medicine to be done, how they want their techniques and clinical procedures to be done. Okay, and then you can practice medicine because you have over the 10, 15, 20, 30, 50 years of experience in the different countries all over around the world. When you come into the States, bang, you got it, you're good. Which happens to doctors all the time. They come here, it's easy. It's easy for them. Piece of cake, especially from the Middle East because they get it all the time. Okay, so I have a lot more to do. I just want to go ahead and give you guys a little bit of brief example of what is the scope of practice as a medical assistant and as a first aid responder, MD. Pretty much, it is within that scope of practice. Okay, especially if you're higher up or if you're certified as I have been certified in I do have a license. But CMS, I have to check the license. I really do. CMS, I have to check the license through for preventive medicine. I have to figure out where that license is at and the credentials. Seriously, I want to make sure that I'm getting out the correct word and let people know really, I do not want to be involved in anything illegal, as well as I do not want to go above my scope of practice, but I don't want to go underneath it either. So, of course, I will continue to practice medicine. Of course, I will continue to apply. And I'm also taking additional classes online. I'm taking a community health class through Harvard X, through Penn X, as well as I'm taking emergency medical disaster training as well. So I'm always taking classes, and that's pretty much what you need to do as a doctor. Okay. Okay. All right. So this is LaQueen Battle, First Aid Responder Services here in Boston, Massachusetts. It's part 2 of my video being Dr. LaQueen Battle. So I am not an MD, a medical doctor. I'm not a doctor of osteopathy. I just have been approved to practice medicine through different agencies and boards. And I have the licenses to back that up. I have been approved to practice different aspects of medicine, not just all general medicine. No, because that's what MD does. I have just been approved to practice particular aspects of medicine. So no, I'm not a doctor. I'm not a medical doctor. It's just that I have been approved to practice a certified aspect of a particular part in medicine. Okay, so I'm going to go ahead and swing this over to the next video. Okay, and talking a little bit more about what it is that I do and what I have been approved and what I have not been approved to do. Okay, so this is LaQueen from LaQueen Arlene Battle from Battle First Aid Responder Services, live here in Boston, Massachusetts. Go ahead and join me on my next video. All right, talk to you guys later. Bye.